Alright, we should be live, so go ahead.
Okay. Welcome back, everyone. Thank you for coming to another virtual shadowing session. Today we have a really special guest. We have Dr. Mahnoor Abid, and she is actually a dentist from Pakistan. And so we're really excited to have her. She's going to talk about what it's like being a dentist in Pakistan. So you can go ahead and get started whenever you're ready.
Thank you so much. I'm really excited to be here. Thank you for having me. My name is Dr. Mahnoor Abid. I'm from Pakistan. I've done my BDS from here. It's Bachelor of Dental Surgery, which is a little different from DDS. I'm going to talk about it later on when I start presenting. What I'm going to cover in my presentation is where I'm from, my education, work, what I've done after my education, difference between BDS and DDS, and some dental advice. Okay, so I'm from Pakistan. Let me know if you can't see the presentation or if you have any questions in between, okay? So Pakistan is a country in South Asia.
Pakistan, a diverse and beautiful country. From its rich cultural heritage in Lahore to the majestic landscapes of Hunza Valley, it is by far one of the most breathtaking countries I have ever explored.
Okay, so Pakistan is a country in South Asia. The capital is Islamabad. It has its business capital, that's Karachi, and its second largest city is Lahore, and I'm from Lahore. Where I work, so I work at a private clinic called Rahman and Rahman. It has a lot of branches all over Pakistan. It has been in service for 35 years and it specializes in dental implants. That's what I would like to do in the future more. I've done a course in dental implants. I'm going to go over it, but it does a lot of other things, but mostly to do with general dentistry, teeth whitening, orthodontics, cosmetic dentistry. It has branches in Islamabad, it has 2 branches there, it has 3 branches in Lahore, it has a branch in Karachi, and it has a branch in Dubai as well. I work in one of its branches in Lahore. I want to talk about my education. It's going to be a very different path from what you guys do. So you guys go to college and then you go to dental school. With us, it's not high school. You guys have high school. We don't do high school. We have O levels and A levels, which is kind of the British system, what they do in the UK. So after A levels, which is kind of like after high school, we go straight to dental school. So I went to dental school. I started off in Karachi. I did 2 years of my dental school in Karachi, which was at Ziauddin University. And then because of personal reasons, I moved to Lahore and I completed my dental school here. So we had 4 years of dental school. Most of the colleges in Pakistan do 4 years of dental school. So after completing your dental school, in order to get your dental practicing license, you need to do 1 year at your college or any other college, and you need to practice dentistry there, do kind of a job but under supervision. After you're done with your house job, you get a certificate, you go to the licensing body, which is in Islamabad, and that's where you license from. So between the Ziauddin and the LMDC period, the Lahore Medical and Dental College period, I did an observership there just to see if I could go there to fit in, will I be able to do it? And I liked it, so I transferred here. Then I did my house job at Lahore Medical and Dental College. It was a completely different experience from Ziauddin, because at Ziauddin in Karachi, we did a lot of hands-on work from day one. They let us do a lot of practice with different dental materials from day one. For example, with gypsum, we didn't immediately start doing patients, but we got to do a lot of hands-on with the material. For example, we made gypsum slides. If we weren't doing patients, we'd practice on dental models and made dentures on models and things like that, just to get to know a bit about the material. After I got done with my house job, I did 6 months of this diploma in general dentistry, because by then I was pretty sure that I wanted to go ahead with general dentistry. And I didn't want to specialize in a specific thing. For example, if I chose surgery, then I'd be doing surgery my entire life. If I wanted to do, for example, prosthodontics, but I didn't want to be stuck in prosthodontics then. I didn't want to be making dentures my entire life. Or for example, be taking out teeth only. I wanted to do everything. So if I wanted to do everything, general dentistry was it for me. But then after that, I kind of realized that I liked pulling teeth out and I liked replacing teeth because it kind of gave me that satisfaction of taking the patient out of pain and also giving them this new set of tooth that could be there for a pretty long time. So I went ahead and I did a 6 months course in dental implants that I did here. And the final session of that implant course was in Germany. So this implant course was something that happens in America. For example, you guys can also do implant courses there. Instead of doing a residency, you can also do an implant course. So I chose to do an implant course instead of doing maybe a master's in dental implants. And then I also did a course with one of these clear aligner companies called ClearPath. They're based in Pakistan also. After that, I applied for a fellowship with the International College of Dentists. I got accepted. So the International College of Dentists have different bodies where a lot of different areas are involved. So I was with the one that was the South Asia region. So my conference where I got the fellowship was in Thailand. That's how I got to go to Thailand, and I got it there. Then I joined the Pakistan dental community. The Pakistan dental community is an NGO that helps try to alleviate dental problems in Pakistan. So with them, I went to SOS Village with my friends, and there we checked a lot of little children. We spent time with them. It was really nice, having a really good experience, and it's good to do charity work, and I really like that people do it, and also it adds to your CV if you do charity work. Okay, so I'm going to tell you how BDS is different from DDS. So for example, if I want to go and practice in the US, I'll have to go through a whole different process, because my license will only be valid in Pakistan. I won't be able to work there. So in order to work over there, I need to do these set of things and go step by step. I'll tell you about it. I know this won't be anything that you guys will have to do because you're going to dental school, but this has a lot to do with people who are international students and who want to practice in the US. So the first thing is to get a dental pin. So let me tell you. A dental pin is this identification number that is obtained by an individual who wants to go to the US. Then the second step is to get your ECE or WES evaluation. So this evaluation will basically take your own country's transcripts. For example, they'll take my transcripts and they'll convert them to the US GPA. Then the third step would be to apply to take the NBDE. So the NBDE was first part 1 and part 2. There were 2 different parts, and now it's one thing, the INBDEs. So you go to the website, that's how you apply, and then there also you can apply for your TOEFL exam. Now the TOEFL exam is the English exam that is mandatory. It's kind of like the IELTS, if someone knows about the IELTS. It's kind of like that, but it's important because it's mandatory. Then I will have to apply for the US visa. So the US visa is an authorization to enter the US by going to the US embassy. Then I take the national board exams. Then I take my English exam, which is the TOEFL. After the TOEFL, then I take the CAPID or the PASS. These are 2 applications through which you can apply for DDS programs, DMD programs, or any specialty programs. Then after that comes the interviews or the bench test. Some of the universities require just interviews for international students. Some of them want them to sit for a bench test, which is going to be an exam where you work on typhodonts. After that is the specialty program or the IDP, which is usually a 2 to 3 year program, or it depends on the specialty that you choose, which could be perio, endo, anything. So for a DMD or a DDS program, different universities offer different years. It could be a 2-year program, it could be a 3-year program, depending on the university. That's how you convert the BDS to the DDS. So this is why it was a huge difference, is the reason why I wanted to talk about it. Okay, so coming back to my dental journey, these were the first tools that were really important to me. So I'm sure you guys will obviously relate to this. I had never seen a patient in my entire life. I mean, obviously you do see people, but seeing those people as patients is a completely different experience. So for me too, this was my first dental patient, and it was in my second year of dental school. we had community dentistry as a subject, and our community teacher wanted us to experience seeing a patient. So they wanted us to take the history. History is basically when you ask the patient about their dental problems, why they're here, their name, all of their facts. So we had to put it down. So we had to do it in pairs. So I was with my friend. I was taking the history and she was going to do the dental examination. And I was scared. I was sweating. This patient was super nice, did not say a thing, but I was super scared. But that was one thing that, I will never forget. And that keeps humbling me. After seeing hundreds and hundreds of patients, I keep going back to that first patient. I think about how, I worked so hard, and, your life is all about just learning always. And then my second first that was really important to me was this root canal. I'm not sure if you guys know about it, but this area is the bone. And this is your root that's inside. So this patient came in with a lot of pain and most of the tooth structure was gone. And I had to do a root canal on this patient. And this was my first root canal. And I put all my Bitmojis from Snapchat on it because I was that excited that I completed it. So these were the simplest of the cases that I could show you guys. Other than that, I have added these cases. These are the simpler ones so that I could explain them easier and you could understand them better. So this was a wisdom tooth. This was a wisdom tooth that had a very curved root. Usually what happens with the curved root is that they break if you take them out. So I'd taken it out. I was pretty happy about it. It was one of my first few cases. I am also doing filling. So this patient had this tooth that they came in with, and I filled it out. And everyone always tries to do a filling that looks a lot like the tooth. So that's how it was. Then this patient came in, they didn't want to get their tooth cleaned. They said they'd just gotten a cleaning done, and evidently they didn't because there's so much calculus deposit. So one of the few things that you need to know when you're practicing dentistry is how to communicate well with the patient and how to convince them. And communication skills development is very, very important. And I feel like now is the time for you guys to do it because you guys are just entering dental school. These are my other few clinical cases. I haven't taken pictures to many of them. So it's a lot of bloody teeth. And I'm sure it's going to be weird now, but later on when you see it, you're going to be like, okay, it's just blood. I've also done implants. I've done second stages, which is the second stage of implant when you put the prosthesis. This is where I was checking if there's enough space for the crown to come in, the tooth part. These are just bloody teeth. And here also was after the implant, we had to do the second stage. My advice to you guys would be right now that I was kind of trying to find a middle ground where we could all relate to it. So my advice to you guys would be to enjoy this time because this time is not going to come back. But with enjoying, you guys also need to do a lot of courses. For example, this course that I did was in my first year. I didn't know anything about sutures. This is like how you guys would probably be going in dental college. I didn't know what sutures were. I didn't know what maybe this is something that can help me with my CV, for example. So building your CV is very important. Can you guys hear me? Okay. So building your CV is very important. So from day one, what I had focused on was, other than going out to do paragliding or skydiving, what I was doing was doing a lot of courses just to improve my clinical skills. that too, along with getting my CV improved. So when you go to college, there's a lot of different societies, and it's important to be part of those societies. Why? Because you can add that to your CV. Being in those societies is going to help with your communication. That is also going to help you go out and talk to a lot of people and meet people. When you do that, you improve your communication skill. Eventually, that's going to transfer to when you do your patients. You guys know that every year so many dental students come out. There eventually is going to be a saturation. Everyone's CV is going to look alike. Everyone's going to have the same CV with the same thing. So in order to be different from everyone, you need to find places where you enjoy what you're doing, and what you're doing is also giving you some sort of happiness. So you need to find that thing, and this is actually the best time in your entire lives to find that out for yourselves. Because eventually when you go to dental school, that's going to be one thing that you're going to be doing for a very, very long time. So you need to find out what exactly you like. If, for example, I'm doing general dentistry, you might not go and like general dentistry. You might end up being in surgery, for example, or prosthodontics or peri or anything. But now would be the time to kind of look out, go to different clinics, maybe work as a dental assistant. That's what I was doing. So when I was in my house job, I didn't get my license. I wasn't allowed to practice, but I was working at the clinic as a dental assistant. So as a dental assistant, I got to learn what the other side of the dentist is, how a dentist assistant is supposed to be doing things, so that helps you with the patient. I was mixing materials, so I knew how the material needs to be done. Private practice is very different from doing practice at college. So in private practice, everything needs to be quicker. It needs to be smoother. Things are supposed to be quiet. In colleges, you don't have that because you have supervision, you have people who help you, but in private practice, you don't. So if you go to a clinic, if you work at a clinic, you're going to learn these things. Other than that, you guys need to manage how you do your patients. Even at college, you can start reporting patients. By doing that, how you're going to actually do that is record every patient that you do. You can have a consent form in your pocket, and you can take consent from the patient. You can take pictures of the patient. Maybe that is how you're going to learn about dental photography too, because you get to practice it. You can attend clinics. You can even ask your supervisors or your teachers at your college that you're going to go to. These things will only happen if you plan them accordingly. So you can ask them to do it. This way you can add that to your CV and also increase your experience. When we used to go to college, we used to have a thumbprint thing. So this was the last day of our house job, and we had gotten it. We had to take in a thumbprint just to leave. So yeah, these are my socials. So if anyone wants to look at my dental journey, or if they have any questions, they can contact me here. These are the socials for you guys. Any questions?
Okay, thank you so much for that presentation. I do have some questions to ask. The first question I kind of had was, could you kind of go into detail about what dental school is like? When do you start seeing patients over there? How the curriculum is? Maybe you could explain that a little bit.
Yeah. So, okay. So it's different for different schools. Like how I told you, I went to 2 different colleges. So it was really different in both the colleges. I can tell you about the colleges that I did go to. So in the first college, like I told you, I got to see patients in the second year of dental school. And that was because of my community dentistry teachers. They helped us go to different areas where we could practice, we could see patients there. That's how we got to know the lower socioeconomic areas where they don't have dental health that's really good. So we got exposure like that. but the college over here would not let you see patients initially, but later on they had a lot of patient inflow. For example, when I was in house job, or even when I was in my 4th year of dental school, we were doing oral surgery. We were supposed to do 150 extractions just to get done with the, so just to pass that clinical side, we had to do 150 extractions. So they didn't have competencies. So in the UK, they have competencies. For example, if you do one extraction and your supervisor thinks that it's okay and you're fine, you're competent enough to do this extraction, you can do more extractions, they'll let you go. They'll say that, okay, you're competent enough. They have competencies. They'll just mark your competency and you'll go on to the next thing. But with us, it wasn't that. It was numbers. So if it was anybody in a class of 75 students, they all had to do 150 extractions just to get through with the clinical side.
Okay. The next question I had is, what was the hardest part of dental school?
For me, personally, the hardest part of dental school for me was transferring from one dental college to another. I would not recommend it to anybody because you get settled, you have friends there, you have a network of people, you know your supervisors, your teachers, you've built up your thing like that, your journey like that, and to disrupt it and go to a completely new place and start from scratch is difficult. And I would not recommend it to anybody. Even though the second college also helped me a lot because I got a lot of dental practice. So I kind of got the best of both worlds. But still, that was something that was super difficult for me.
Yeah. I was also wondering, how common is it to specialize? Do a lot of people specialize over there, and or do most people consider general dentistry?
Okay, so here, the first thing as soon as you come out of college, because everyone has seen their teachers, everyone thinks, oh wow, this cool case of maybe prosthodontics or maybe this surgery that came up, everyone wants to specialize. General dentistry is not common. It's actually frowned upon here. Mm-hmm. So a lot of people go on to specialize, and they have to take this exam called FCPS. That's a local Pakistani exam. After your FCPS, you specialize into different whatever field that you want to. Then they have to go for 4 more years of practice in that specific field and specialize in that specific subject. But eventually, what I saw was that even after you do specialize in different specialities, you do end up wanting to have your own clinic. And when you have your own private practice, you would want to do different things and not just be in, especially in a place like Pakistan, a specialist practice is very hard to maintain because here people are not that aware of their basic dental hygiene protocols. So if you consider dentistry over here, general practice is something that everyone does. Even if there's a specialist who is doing surgeries in the morning, they're going to be doing a root canal in the evening because that's how things work over here.
Okay. Kind of going off of that, you kind of talked about the demographics patient-wise. Over here, dental treatment is expensive. So how do people who are more low income in Pakistan, how do they have access to dental care, and what avenues do they have for getting access to dental care?
Okay, so in Pakistan too, everyone, since it's a third world country and not a lot of people have access to normal food even. So for them, it's not more about the money, it's more about their priority. So if there's someone who is earning enough money to just sustain their basic living, for them, then dentistry and their dental health is not going to be their priority unless they're in actual pain. So a lot of people who do come up to a dentist is going to be people who are in a lot of pain. And by that time, either it's going to be a root canal, which they won't afford, or it's going to be an extraction, which they would go for just to get rid of the pain. So those sort of people usually go to the colleges, where it's usually students who are doing it. And I feel like that's what happens in most of the world too. Even in the UK, people who are in old age homes, or even in the US, they get access to dental care from colleges, where it's cheaper to get dental care rather than a private practice. So where I'm practicing is kind of the high-end practice. So people who come here don't come specifically for pain. They do come for cosmetic procedures as well.
Okay. The next question I had was, how is the COVID situation in dentistry over there, and how in your practice specifically are you guys handling prevention?
Okay. So the COVID situation is really bad in the entire world. The numbers are going up. Initially, when the first lockdown happened in the entire world, the cases were way lesser than what they are right now. But I feel like people don't have that fear in them anymore. And we do see a lot of patients, which is really, really annoying, that there would be somebody who would walk in without a mask, even though we have this big sign outside in red that says, do not enter without a mask. And a lot of places, for example, shopping malls or restaurants, even they don't let people come without a mask. But I don't understand how people can come in without a mask. So in our practice, what we do is that we have a person outside, right outside the gate, that sprays the feet with a disinfectant. Then the patient comes in, they're supposed to be wearing a mask. They're given foot covers, so they wear their foot covers, and then they go straight inside the surgery. We used to have a waiting room that was usually full with people, and people would be chatting and sitting. We are trying not to have anyone wait at all, and attendants are not allowed at all. So even if there's children, it's difficult to talk to the parents, especially if they have a child, to let them go inside. If someone's really small, we let the attendant go, but mostly we don't. And when the patient is inside, then the doctor has their proper PPE, they have their head covers, they have their gloves. That's something that's being done.
The next question I had was, why did you choose dentistry, and did you ever consider going for medicine, and sort of why you chose dentistry instead?
Okay, so it's funny because I wanted to become a doctor even when I was 3 years old. I think it was mostly my parents putting it in my head. And it's more of an Asian thing for parents to just put it in their children's head to become doctors. So when I applied to Ziauddin, it was for medicine and dentistry because I wasn't sure at the time. And even when I got called in for dentistry, I still wasn't sure. I went for my interview. When I went for my interview, they made me write an essay, and they asked me why I wanted to become a dentist. I think that was that turning point that actually made me sit down and think about it, because you're so young when you're applying to dental school, you're not really thinking about your future and how it's going to be, and you don't know what dentistry is all about. And I hadn't done a lot of my research, but I really sat down and I thought about it, and when I got in, I felt really lucky. I'm happy that I'm a dentist.
Okay. The next question, what is something you wish you knew before you became a dentist?
So when I was going into dental school, I didn't know that dentistry could be so vast, and I had to practice a lot, and I wish I'd done a lot of clinic before going to dentistry. I had not done my research at all. I wish I had gone to a clinic just to see, and I would really, really advise all of you to at least go to a clinic just to see how clinics do work. because I had no idea. Even if you're in college, for example, like I told you, private practice is completely different. If you go to a private practice, the way they work is very different from how a college works, for example. So I wish before dentistry, I'd gone to a clinic just to see how things are.
Okay. You kind of mentioned that you did the implant course. Why did you choose to do that, and what got you into implants?
So after I graduated, I was doing 2 different clinics. It was Rahman and Rahman, where I'm working right now, and there was another clinic. So I was doing Rahman and Rahman in the morning, and I was doing the other clinic in the evening. That clinic was mostly to do with surgery, because the owner of that clinic was an oral and maxillofacial surgeon. So his patient inflow was mostly surgical patients or post-surgical patients or implant patients, or maybe surgical extractions. There's a difference between a normal extraction and a surgical extraction. Your tooth could be completely impacted in the bone, and you would want to get it done by an oral surgeon, and they'll basically make a cut, they'll drill the bone and then take the tooth out. So I had a lot of exposure of surgery there, and that's where I grew my interest in implants. And he used to conduct these implant courses, and that's how I got to take part in it. And there was actually 3 different courses. The first one was where I was a participant, and the rest of it was where I actually helped people at the course.
How you kind of talked about like private practice is different. So like if you wanted to open a practice, what's the process like? Is it very expensive, and would you ever consider doing that?
So eventually I'm going to open a private practice. I think eventually everybody wants to open their own practice. Initially, what we do is that we do work at different clinics. For example, the clinic that I'm working at, it helps you a lot because you're under an umbrella, and you get all that support. It's because when you go to a practice, you understand that it's not only about dentistry. There's so many different things to it. There's the finances, there's talking to the lab, there's your dental material. For example, if the dental unit gets ruined, there's something that gets broken, who are you supposed to call? If there's an electricity fault, what are you supposed to do? If, for example, at the clinic, our washroom wasn't working, so what are you supposed to do with that? You're supposed to know all these things. So I don't think I'm ready to have my own practice yet. And yes, money is important, and dental practices are definitely expensive because you need to get the dental material, you're supposed to get the dental unit, a whole team. So in order to organize all of that, you need to be ready. And when you're ready is when you get a lot of practice at a different practice. It's been 2 years since I've been practicing.
That sounds cool. I was also kind of interested in the NGO that you were a part of. Could you kind of explain a little bit more about how you got interested in that?
Yeah, so like I told you, how your CV is important. So what I was doing in my dental school was exploring a lot, because I didn't know what I really would want to do. Did I want to specialize? Did I want to continue with dentistry? Would I want to go in the management side? Because a lot of my class fellows went into management of healthcare, and they didn't pursue dentistry per se, but they went into management. So I was kind of exploring. That was the time when I was exploring. And that was when, I'm sorry, I think I lost your question.
I was just asking like how you got interested in it. Yeah, sort of what got you into it.
I'm sorry, could you repeat the question again?
Yeah, sorry. I was just asking what got you interested in joining it, and I think you kind of answered it.
Yeah, so that's how I got into a lot of NGOs. And after I graduated, most of the different societies at college, they only work for students that are in the college. So after I graduated, this was the only and first NGO which was completely dental based, and that's what's working in Pakistan right now. So I joined it, and it's more to do with people who are in Karachi, and they're more active there, and they do their outreach programs in Karachi a lot. So here they didn't have it a lot, and so this is why I had to gather my own team. This is something that also shows leadership skills in your CV. So it's good and very important for you guys to do it too.
Okay, we had a question that said, what did you do for your fellowship? You mentioned that you worked in Thailand, so could you talk a little bit about that?
So I didn't work in Thailand. That was where the conference was. The International College of Dentists conference was. Wait, let me just go back to the slide. Okay, so for the fellowship, this fellowship is awarded to dentists who have done extraordinary work in dentistry. So what we had to do in our section was that we had to apply it through this form, and you had to tell them everything that you've done in dentistry. Then you're supposed to have an exam, and then there's an interview, and after the whole selection process, then they tell you if you get selected for it, and then you're awarded this fellowship. So for our section, our head was in Pakistan, and I got selected. One of my teachers was also selected in the same group, and we all got to go to Thailand.
Could you also maybe talk a little bit about like your work schedule? What's your like daily routine, and how do you balance like your personal life and work, obviously?
Okay, so I'm somebody who is a workaholic, and I think that it's not too glorious for someone to be that workaholic. So initially I was working at 2 different clinics, and I feel like I was like killing myself. It was good for my CV and I was getting the experience, but it wasn't good socially, and it's important to have your social side balanced with your work side. So that's when all my friendships got compromised a lot. But that as soon as I realized it, I just stayed at one of the clinics. I worked from Monday to Saturday, and I work from 12 to 6 p.m. And before the 12 p.m., I usually go to the gym or I go for a swim. And after 6 p.m., I usually go and meet my friends. And on the weekends is when I usually go out for drives or hang out with my friends or do something like that. And I like to travel a lot. And if you look at my page, you're going to see a lot of traveling videos, or mostly driving videos of me driving everywhere, because I want to eventually be that girl, because they tell you girls are really bad drivers, and they have all these memes about girls being really bad drivers. So I want to be that one girl who's driven everywhere in the world. I've driven in a lot of countries, but there's still a lot of them that are left.
Yeah, that's so true. And I think the last question that we had was, would you do cosmetic dentistry? And have you ever thought about that?
Okay, so cosmetic dentistry is something that's more of like the new in thing, and everybody wants to become a cosmetic dentist and restore teeth like that. But for me, I don't know. I am not somebody who's going to say no, this is really wrong, and when people are doing cosmetic dentistry, that's really wrong, because they do change people's lives and the person does look very different. But for me, the natural tooth structure is very important. So if the natural tooth structure is being compromised in any way, even if it's 0.5 millimeter or 1 millimeter, you're never going to get it back. You know what I mean? So even if there's a patient who comes in and says, my teeth look, bad, and if their teeth don't look that bad, they're acceptable, I would tell them that, look, your natural tooth structure is going to get compromised. And I'm somebody who's not for it. If you want me to do it, I'll do it, because I have practiced it and I can do it. And I would do it for people who have, for example, fluorosis. I am not sure if you understand fluorosis. It's when there's a lot of fluoride in the water intake. There's a lot of areas in Pakistan that have a lot of fluoride because it's not regulated properly. So in fluorosis, you get those different color bands on your teeth. So if there's somebody who comes with fluorosis and they want a veneer, 100% I'm going to be like, go for it. But if there's somebody who, for example, has teeth that are just a shade yellowish and they want veneers, I'll be like, no, why are you doing that to yourself? You're going to get sensitivity in the long run.
I have one more question. I've been hearing a lot about digital dentistry and how that's changing. What is your thoughts on that? And have you gotten any experience with more of the technology that's coming in dentistry?
Yes, I have. And I'm all for it. But you need to understand that there's a lot of people who are bringing about things and new technology that's not too helpful. But the things that are helpful, for example, in patient diagnosis, or maybe to just convince a patient, would be the intraoral camera. That's something that I feel like has really changed dentistry, in the sense that if you tell a person that, this tooth needs to be taken out, they'll be like, wait a second, what? I didn't come in to get my tooth taken out. But if you show it to them and you have the intraoral camera and you show it to them on a big screen, you're like, here, your tooth, this is what's happening with your tooth. They'd be like, 100% take it out right now. I want to get rid of it. So it has really changed. And for example, with the CAT cam, you can get the crown made instantly. The patient's going to be sitting there in one sitting. They don't have to take an extra day off from work, for example, or travel so much just to get to you, and you get your crown made immediately. That's amazing.
Yeah, it is. I was also wondering if you could talk about, we have to take the DAT as an entrance exam. Is there an entrance exam over there for dental school?
So there's different exams for different schools. So, for example, Zawdin was an independent university on its own. But if there's a government college, government and private is different. If there's a government college, for a government college, there's one exam that everyone has to take. And then according to your grades, that's how they decide which college you get to go to.
Okay.
So it's a little different.
Yeah, it's a little different. One more question I had was, do you ever have a difficult patient and how do you deal with it?
Sorry?
Do you ever have difficult patients and how do you deal with them?
I get difficult patients all the time. Because I feel like if the digital world has helped us a lot, it has also made our life a bit more difficult, in the sense that every patient is going to come Google and everything, and then they're going to come in, and then they're going to come in and they're going to say the most absurd things, and they'll just Google something and they're going to be like, no, I don't want A, I want a B, and that B is something that's going to be completely ridiculous. You're trying to explain it to them and they're not going to trust you. They're going to be like, but Google said that B is something that I need to get done. Why are you telling me that A is good? So I feel like it's mostly to do with social media. But also a lot of patients, and I would say most of them, the first thing that they come in and they do is they would sit on the dental chair and they'll tell you, we hate dentists. I feel like that's something that can just ruin your day.
Yeah, that is so true. Kind of going off of that, how do you think oral education can improve in Pakistan, and what are the changes that have happened so far?
So I feel like how I talked about people not having enough money for their food, I feel like unless that changes, their want or their priority for dental health is not going to change. But Colgate is doing a really good job, and Sensodyne is doing a really good job with GSK. Sensodyne and Colgate, they make these ads that are coming in our language, and they help educate patients a lot about how you're supposed to brush your teeth. And maybe there'd be someone who doesn't have enough money, but they know that they need to brush their teeth now. And maybe 10 years ago, that wasn't the case. So the complete basic, for example, just brushing your teeth, that's something that's, coming up mostly because of these adverts.
Yeah. I think that is all the questions that we have. Let me see. Yeah, I think that's everything. Thank you so much for doing the session. We really enjoyed it.
Yeah, thank you for having me.
Do you have anything else that you want to say last minute?
No, that's it. I am just really glad that you guys are doing this. This is a really good initiative for you guys as well, because you will be learning a lot from dentists who are practicing. So I'm happy that there's people like you out there, because I was one of you guys, because I was really curious about things and I wanted to go out there and learn, and I'm glad that you are. And thank you for having me.
Thank you so much. I think that's it. So yeah, thank you guys for watching, and we will see you